Welcome to our instruction course on International Fellowship Examinations and Career Options after Post-Graduation. This course is actually a little bit of an amalgamation of two different courses. We are trying to cover a lot of topics which are both individually unrelated but also a little vague, because we expect that there are a lot of questions and a lot of queries in the minds of recent postgraduates or even those who are currently doing their residency programs. Ophthalmology has changed. I sound like a very old man saying this, but it has changed in the last 10 to 15 years as well. And now there is a vista of opportunity and options available for anybody who is at the early end of their career. And we will be trying to touch upon some of these options. These are probably the more common ones or the ones that are better known, but there may be very many ideas which we can also discuss from the audience. We hope to make this session a little interactive, and we hope that there will be a lot of feedback and a lot of input from the audience as well. So otherwise we'll introduce. Okay, so we'll introduce our speakers and we'll invite them to the dais. We first have our visiting faculty, our special guest, Dr. Sharfuddin Ahmad. Please join us on the dais. Sir is joining us from Bangladesh, and he will be delivering the keynote address at the conclusion of this session. Welcome, sir. We invite Dr. Parthopratim Majumdar. Please join us on the dais. Dr. Parthopratim is well known amongst postgraduates and students of ophthalmology for many reasons, but principally also his website eophtha.com, which has helped many students pass their examinations, yours truly included.
So we welcome you for the presentation, and we are really looking forward to your presentation and talk on resource options for training in ophthalmology.
While Dr. Partho is setting up his slides, we request also to be joined by Dr. Rashmin Anil Kumar Gandhi. Welcome, sir. Dr. Rashmin Gandhi will also be speaking to us towards the end of the session on career options beyond ophthalmology. And Dr. Devesh Kumawat, please join us, sir. Dr. Devesh will be speaking to us on the FRC Opht examinations and how to go about those. My co-instructor, Dr. Pranita Sahai, is also with me on stage. Welcome, Dr. Pranita, and I hand over to you to...
Thank you, sir. So without much delay, we'll now start the session with the first talk by Dr. Parthopratim Datta Majumdar. So we'll be talking about resource options for training in ophthalmology.
To continue Dr. Partho's introduction, he is a senior consultant in the Department of Uvea and Cataract at Shankar Nethralaya. He completed his fellowship from there as well. He is an avid researcher and is extremely interested in ophthalmic education. And he's, I think, the right person to talk to us on various resources, both electronic and non-electronic, available for students of ophthalmology.
Thanks, Deb, for a kind introduction. So, good afternoon, everyone. So, I think after the lunch and post-lunch session, so let's start with something very interesting. So, it's all about resource option for the training in ophthalmology. So, before I go into that, my presentation, which will be mainly, I'll be showing you various resources available mostly in the internet and electronic media. So before I go there, you have to remember that the most important or resourceful we have is our books, textbook. So you have to keep that in mind, and with that, we'll just start our presentation. So I'll start with a very important opportunities AIOS has given us, that is the access to the One Network. So this One Network is one of the brilliant resource an AIOS member can actually browse. So you have to write to the secretary and take the login, create the login ID, and then you will get the access. So what you have there, you can access lot of journals like ophthalmology, entire segment you can actually access. You can access the American Journal of Ophthalmology, Survey of Ophthalmology. So all this journal can be accessed through this one network in journal sections. So next you come, I always, sometimes whenever I read something or any after a certain period of time, I just test my knowledge with that. So all of you can actually go with that. There is a section called Test Your Knowledge. So it's a very interesting, it's like multiple choice based option. So you can select, there are a lot of options there like cataract, cornea, glaucoma, and you can take the test and again log out, and again you can log in. So it will show you the percentage of the question you have completed. So here is an example actually I have taken in UVIT. So there will be a case scenario and they will give you 4 options, and most interestingly there will be a discussion on it. So once you attempt that, you will be given a proper discussion and reasoning on that. So it will be helpful for you to update your knowledge. So the next important thing is that their guidelines. So if you go to that, you will have a lot of options like most importantly the PP, preferred practice pattern. So there are several monographs or the PDF files are available in that segment. So you can go through them. And there are certain some non-preferred practice pattern also, like current trend in the biosimilar in ophthalmology. So this kind of monographs are available in that section. So next is very important, very quick way to just browse, update your knowledge or just test your clinical. This thing is that diagnose this, where you will be given a photograph and there will be a case scenario, and same way you can take a test, and they will provide you with a lot of discussions, and even the references are there. Like you can browse the particular article if you have further query on this. Now, there is another website, those will be preparing, I think the subsequent speakers will be discussing that. So MRC Optha and all. So there is, I think, one of the best website we have, that where there are a lot of options for taking multiple choice questions, going through the OSCE, and little bit of various trials and the trivia in ophthalmic history. So it's a beautiful, I think you must visit this site and browse it with taking a test. It has even dedicated section for some commonly advised investigations in ophthalmology, and there are various snippets on the ophthalmic images and various interesting clinical information. So next, my favorite is that eye rounds. If you see in EOPTHA also, we try to replicate this kind of in Indian ophthalmology. So it is a very, very nice website by the University of Iowa. So you will see there are a lot of cases, atlas, and videos are available, and tutorials, and all free. You don't have to log in also. You can browse the website for free. So you must visit this website. The second one is very important for the same same institute. It's all about gonioscopy. So you'll have multiple videos, multiple presentations, multiple tips on how to perform or how to excel in gonioscopy. So you must visit this site gonioscopy.org. Now here is another, recently they have launched that Stone Rounds, and it deals with all heredomacular degeneration mainly, and you will see lot of clinical photograph, very rare heredomacular degenerations, retinal degenerations. You'll get the photograph, you will have the details discussion on this. You can't even ask a questions, and they will come back you will give answer to those questions after a certain period of time. So this is another, and this is very important for all practicing ophthalmologists or the trainees, those who are interested in learning something. It's almost like a quick course, like online you take a photography course, online you take So it's the cyber side has a dedicated section like biomedical engineering. It has sections on even for the nursing. So if you are interested, you can refer your nursing staff also to take that. So it has a module kind of this in several subjects. So let me show the first module. The first module is on about, if you take the module of MICS, you can see that there are several modules there, and each module has a dedicated video. First they will ask you for pre module assessment, where you will be given a list of MCQ, and once you go through all this video, like cataract basics, history taking in a patients with cataract, the screening of high risk patients in your setting, IOL calculation for cataract surgery, all dedicated videos are available. So once you finish this module, you will be provided with another set of questionnaire, and once you finish that, they will give you a certificate. So it's highly recommended for everyone. You can go ahead with take the test, and there are certain like other you can see here that non-surgical management, how you can approach a adult cataract. And there are like what are the difficult cases. There are snippets for quick revision, like what are the difficult for example, in this scenario you can see the deep set eyes, what are the possible problem and what are the potential action or strategies you should follow. Similarly, in Fuchs corneal endothelial dystrophy, what are the difficulties you can encounter. So all these are there in this modules of cyber side. This is another, if you have a long means you have to travel daily a long distance, you are stuck in traffic. So nowadays they are calling it as traffic university. That means every day you listen to something, some podcast or something while going to your work or coming back from your work. So I think this is one of the very important this thing, that Retina podcast. This is the from the straight from the cutter's mouth. So there are dedicated, as you can see here, we are talking about that episode 388. So it's a brilliant concept. You all of you must, those who are a vitreoretinal surgeon or interested in vitreoretinal surgery, so you must actually visit this podcast and try to utilize it. Second one, for all the ophthalmologists, we have that Eyes for Ears. This is another again podcast. So if you are going for a walk or you're stuck in traffic, as I said, so this kind of podcasts are very interesting resource for you. So you can actually take a lot of modules are there. You can even take the modules for your learning, and you can go through some of them. This is another OCT cases, very good for the OCT if you want to learn about the OCT. So there are specific OCT pictures, and there will be dedicated discussion on OCT picture. Believe me, this is one of the most brilliant imaging based resource you can have in your mobile or in your laptop. So do browse this. So this is eOptha, which I created when I was a ophthalmology student in Silchar Medical College. So it has grown exponentially, like from all of you have contributed. So it has a lot of PowerPoints, fellowship information, a lot of articles by the senior ophthalmologists and teachers. So if you have not browsed it, please go through them. This is another by my junior friend. So he has started this iLearn, which has a lot of option for the resident. Like you have the question bank, you have dedicated interview on various fellowship in various institutes. So you must browse this. This is another by Dr. Santosh Honawar and Center for Sight. So this is a iFocus online. All of you know that it is available in YouTube, and also it comes as a Facebook Live. So you can browse a dedicated video. It has several subspecialty episodes, and where multiple episodes are there. So this is another must visit for all the ophthalmologists and ophthalmology students. Just coming back to my last topic, that searching that PubMed. So it has become very, if you see the PubMed's inherent search engine is not that powerful. Sometimes you will search certain keyword, it will be difficult to reach the proper article and all. So that's why one easy way of searching PubMed is that you go to Google, put that topic, just give a comma, and write the PubMed, and then you can search. That Google search engine is sometimes much more powerful than the PubMed search engine, inherent PubMed search engine. And this is one newly coming, that ChatGPT and AI based 1 minute. So AI-based module, which actually with the help of ChatGPT, they are developing. So my friend Dr. Jay Chablani is working on that. So where they have created a module where you have to give something like, for example, if you say write what is pink eye, they will define pink eye. They will define the conjunctivitis from a PubMed reference. So anything in ophthalmology you want to ask the definition, it will give you the PubMed reference for that. Second, if you ask that chatbot that how the conjunctivitis, how the scleritis is being treated, it will give you the complete algorithm based on the PubMed reference. So that's it. Thank you. I'll be happy to take any question you have.
Thank you, Partha. This is really very good as expected. There are a few more resources. So what he's saying is that internet is full of a lot of knowledge, but a lot of that knowledge is not filtered. And whatever he mentioned, or whatever website that you go through, should have a filtered knowledge. Now, some of the other sites which would be useful, especially for people who are going to write exams, would be iWiki. Now, iWiki has very large number of articles on every specialty. Like in specialty like neuro-ophthalmology, they have 350 articles. And the good part about those articles are they are all being curated by faculty, and then there is an editorial board which reviews that article before it's published. So iWiki is a good source. A word about ChatGPT. ChatGPT slowly is becoming a little mature. In fact, you can give a case scenario, and around 60 to 70% of the time. So if you write in ChatGPT, a young female, acute loss of vision with pain, and the vision loss is poor or whatever, they will come up with answer which is fairly accurate. Like ChatGPT will come up with optic neuritis as one of the main differentials. So it is becoming more and more mature. It's an AI-driven algorithm. More we use it, more mature it will become. So I wanted to talk about these two, iWiki and ChatGPT.
Great, thanks for that input. I welcome any questions for Dr. Partho from the audience. We have a lot of resources. Maybe if I can ask Dr. Partho a little loaded question. How do you prioritize? I mean, now there's a plethora of information and websites and resources. Would you really be able to guide us to which are the ones which are probably better suited for certain topics, or should one really go through all of them so that one gets a flavor and then prioritize?
Yeah, I think it will be, it depends on few things, like what subspecialty you are browsing for. So there are some dedicated websites. For example, I showed that if you need to know about gonioscopy, so you can browse that. The best resource, if you ask me, the PubMed is the best resource because it has the evidence-based literature. So whatever you search, I suggest, for example, if you are searching for treatment of something like scleritis. So if you search the Google with that the treatment of scleritis, PubMed, then it will show the PubMed this thing. And another good way of searching literature or information is go to PubMed, search a topic, and just go through the freely available review article. So the best way to update your knowledge, because as Rashmin Gandhi sir has pointed out, there are a lot of information in the internet, and you have to be very careful when you are browsing them and taking something important for you to imply in your clinical practice. So I think the PubMed is the best this thing.
I'll probably add a little bit more. I mean, when you go to internet to search, basically there are two main streams. One is you want to know what you want to search, like you want to know about optic neuritis or you want to know about gonioscopy. And the second is where you encounter a topic or a patient where you don't know much about it. So these are the two. So there are specific websites which will give you a clear answer about what you are looking for. Like in neuro-ophthalmology, there is a website called Novel. Now that's a very, very rich resource where you have past 30 years North America, all neuro-ophthalmology conferences are available there, either in a document form or in a video form. Plus, there are articles which are available, the videos. I mean, neuro-ophthalmology is all about ocular motility. So a lot of videos on nystagmus, which is available. So if you know what you're looking for, there are websites for that. If you don't know, let's say if you're stuck with a case, then ChatGPT, algorithm are the websites that you look for.
Thank you. We'll move on to our next speaker, Dr. Pranita Sahai. Dr. Pranita completed her MD from the All India Institute of Medical Sciences. She subsequently did a senior residency in cornea and refractive surgery also at AIIMS itself. She is highly qualified, having done the FICO, the FAICO, the FRCS, and the FRC OFT examinations, and currently she works as a consultant at CFS in New Delhi.
Thank you, sir. Thank you, sir, for the introduction. So, as you all know, there are multiple exams that you have an opportunity to give along with your post-graduation. You have the FICO, FAICO, FRCS, FRCO. So, which one to choose, how to prepare, and when to give the exam is the question that we need to ascertain and establish so that we are well in time, well prepared, and complete all the exams without failures. So when you're doing your post-graduation, you need to be clear about what is your future plan. Whether you want to go abroad, settle abroad, or you just want an international fellowship training from outside India. So based on that, then you choose the exams. As we discussed, you have the exams like ICO, FRCS Glasgow, Edinburgh, Ireland, and also the FRC OFT. So I'll be dealing about the ICO exams. Now, the ICO exam is quite a structured exam with multiple steps. You have Part A dealing with basic sciences, Part B dealing with optics, refraction, and instrument, Part C, the clinical ophthalmology, and then the advanced exam. Also, the ICO in the past few years have come out with the subspecialty exams. Now, there are certain advantages of giving these exams. One, that you get a post-acronomial of the FICO that adds to your qualification and CV. Second, it gives you exemption from other exams, that is the FRCS Glasgow. So, how to go about preparing these exams and when to give this exam is the first question. So, first of all, I would like to ask you, how many of you are postgraduate students or fellows who are sitting out here? Can you raise your hands? So we have quite a few. And have you appeared for the ICO exams as of now? Anyone? No. So I think you're looking forward to preparing for it. So what do you think is the right time to start appearing for these exams? Can anybody answer? Do you start in the first year, second year, third year? What do you think is the right time? Anybody? So I think with the end of this talk, things will be pretty more clear. So for the FICO Part A, you will need to understand that other than the anatomy and physiology of eye that you deal with in these questions, there are also some questions related to basic sciences, wherein questions of neuroanatomy, genetics, biochemistry, pathology, and microbiology are asked. Hence, that the best time to appear for this exam is in your first year of post-graduation, because that is when you're fresh with this MBBS knowledge. Now, this exam is an MCQ-based exam. The best part of ICO is there is no negative marking. So always go and attempt all questions in your exams. What to read? As for anatomy and physiology, you read Khurana, American Academy of Ophthalmology. Another very important book is by John Ferris, which is on the basic sciences and ophthalmology, a self-assessment guidebook, that it is in a question-answer format with detailed explanation of every question. So that book is really helpful when you're preparing for FICO Part A. Part B deals with optics refraction. Again, an MCQ-based exam, no negative marking. Books on Elkington, Chua's optics book, Duke Elders, and the book by Khurana. These are some of the important resources for this exam. The third part is that of clinical ophthalmology. This is just like your postgraduate MD or MS final year exams, wherein you need to have a detailed knowledge of the theory related to ophthalmology. So you need to read Kansky really well and American Academy of Ophthalmology. Again, this is an MCQ-based exam, no negative marking. It also gives special emphasis on general medicine-related questions in ophthalmology and community ophthalmology as well. The final step, which is the advanced examination, gives you the final degree of FICO. Now, the question preparation format is not very different from clinical ophthalmology, but here the questions are more focused on case-based scenarios or clinical scenarios. Hence, Once you're done with your MD exam and your practical exam, that is the best time to appear for it because you have an in-depth knowledge of this subject at that point of time. Also, there are questions related to ethics and community I, which you need to read in addition to just your practical ophthalmology. So again, you need to read Kansky and American Academy of Ophthalmology remains the same as that of part 2. When to appear, we have already discussed. Part A, start in the first year of your residency. Part B, optics refraction only after 6 months or 1 year. That is when you get a basic hold of your refraction. Part C, after your MD exams. Advanced examination after you're done with your practical. Coming to subspecialty exam, you're eligible for it only after 1 year of fellowship in that particular specialty that you've been trained in. Now, don't start giving exams just randomly. Be well prepared because it comes at a cost. And yes, if you appear for all 3 steps of just ICO, it costs about 1.5 lakhs. So be prepared for the exam, only then appear for it. And be sure that what is your agenda of giving the exam. If you're looking at an international fellowship with grants, then this is a good platform. FICO will give you the post-acronomial of FICO, opportunity for fellowship with good scholarship and grants. Moving on to the subspecialty exams, as I told you, you are eligible for it only after you're done 1 year of your fellowship. So there are 2 platforms. One is FICO, the other is FAICO. The FAICO is given by AIOS itself. Both of them gives subspecialty exam options. Now, why is it important to give a subspecialty exam? For example, if you're going to go into private practice, often even if you've done your senior residency in cornea, someday your patient is going to come and ask you, are you trained in cornea? And then you actually need to convince them that yes, you have a qualification which declares you that yes, you are trained in cornea. So if you want to do a subspecialty practice, I think it is really important that you clear these exams well in advance so that, when you are facing these questions, you don't hesitate in answering. So the subspecialty exams come in cornea, glaucoma, retina, oculoplasty, neuro-ophthalmology, strabismus, uveitis, and cataract. Again, it's an MCQ-based exam, no negative marking. The advantage of FICO subspecialty is there are no practical exams involved. It's easier to clear. If you go on to FAICO subspecialty exam, you also have the option for giving refractive surgery and comprehensive ophthalmology exams and getting degrees for that. The disadvantage here is you have a practical exam. After you clear your theory, you have to face a viva just like you face in your postgraduate examinations. So only if you are well prepared, then appear for it, because the failure rate in practical exam is quite high in FAICO. So in the end, I would just like to conclude that you can look at the ICU exams if you want to go ahead for an international fellowship. If you want to go into a specialty practice, go for a subspecialty exam like FICO and FAICO. Plan well in advance and appear at the ideal time, because appearing earlier or later, both is going to put you in a disadvantageous position. Thank you.
Thanks, Dr. Pranita. I think you made my talk coming up a little later very much easier and shorter. We will take a question from the audience now. If rather than focusing the discussion, is anybody appearing for these examinations, the ICO, right now? And if they have any questions, we'd love to, or their experience of the examination, we would love to hear from you. Okay, then what we will do is we'll probably take questions and discussion after the next 2 talks. Please go ahead. Yes.
Unfortunately, there is no structured place where you can find questions for them, because as you know, these are booklets that are collected at the end of the exam. It's only by recall basis your seniors can let you know what happened in the last exam, but there's no structured place where you'll find questions for it. The FRCS question, yes, in John Ferry's there are recall questions that are placed in there, but unfortunately, I'm not really aware of something that helps in ICO. Okay, thank you. So our next talk is by Dr. Devendra Venkati Raman. He'll be talking on FRCS Glasgow, when to start and how to excel. Sir has done his fellowship in vitreoretina from LVPI Hyderabad. Subsequently, he has also done his FRCS Glasgow and MRCS Edinburgh. Currently, he is working as a consultant retina specialist at Lakshmi Eye Hospital and Institute at Panvel.
Thanks, Dr. Pranita. We've actually been privileged to have this instruction course for the last 6 years in AIOS. And it's always a learning for us, because we keep learning something new about the topics that we are supposed to be experts in. So just to give you a brief overview, the Royal Colleges are established in the UK and have been around for, in some cases, more than 500 years. So these are really colleges or centers of training and learning which have a very rich history. And it's probably something like this that attracts us to give these examinations, to be part of something with such a grand tradition that makes us interested in giving these examinations. I'll be focusing on the FRCS Glasgow. Basically, it's a degree examination that is held by the Royal College of Physicians and Surgeons of Glasgow. And these are a few images of the city of Glasgow, where we had visited after clearing the examination for the convocation ceremony. This is a little treat you can promise yourself to do at the end of the examination, to treat yourself. That's a deep-fried Mars bar, incidentally. Glasgow is the heart attack capital of Europe, in fact, because they have a lot of deep-fried food. A quick tip, this is my friend and colleague, Dr. Asif Virani. We studied for the examination together, and we made a pact that if we should clear it, we would go for the convocation together. It's very useful to have somebody you can study with, because it really makes life a lot easier. And these are some of the glimpses of the very glittering convocation ceremony. So the examination is basically in 3 parts. The format has changed in the last few years since the COVID epidemic. The first part is basic sciences and optics. It's a 160 MCQ paper, which is 2 hours long. The second part now does away with the original long answer question format. Now it's only MCQs of 180 in number, and you have 2.5 hours to fill up those MCQs. There are no long answer or essay questions as there used to be in the past. Part 3 is still in 2 forms. Can we do that later? Part 3 is in 2 forms. There's a structured oral examination, which is nothing but a viva, which has OSCEs with it. And it covers 3 differing regions of the eye, which is lid, oculoplastics, and anterior segment. Posterior segment as a separate viva, and neurology, motility, and general medicine as a third. And the clinical examination, where you would be invited to see patients, is again divided into 4 different stations, where you see different patients related to that specialty. The top point to note is that those sections of ophthalmology which we were very happy to leave as option, as it is called in the Indian examinations, whether it was neuro-ophthalmology or oculoplasty, you cannot afford to do that, because there are individual stations here and you need to pass every station to be awarded the degree. So you cannot leave for option, for example, oculoplasty or neuro-ophthalmology, because you have to pass in that separately. The eligibility has also been simplified in terms of its language. Now, basically, you need to have your primary qualification that needs to be recognized by the GMC in the UK. MBBS in India is recognized, followed by your 1 year of internship, followed by 1 year clinical experience in any field. So if you have done a clinical posts of a year, or an observership of a year in any field which is not ophthalmology, you can still appear for part 1. But when you get to part 2, you should have completed 5 years of post-qualification training. At least 54 months should be in clinical ophthalmology. So unfortunately, a research ophthalmology fellowship cannot be shown as part of this 54 months. And to appear for part 3, you need to basically have completed parts 1 and 2. There are exemptions, as Dr. Pranita mentioned. You are exempt from part 1 if you've completed the ICO examination part 1, etc. So you can go through those, and you don't need to replicate and duplicate your efforts to appear for all of these parts. The fees are a bit of a headache. So whereas ICO added up to 1.5 lakh rupees, this crosses 2 lakh rupees. The fees increase by at least 10% every year. The pound had depreciated a lot during the COVID time and during Brexit, but unfortunately it's bounced back up, unfortunately for us Indians. So look forward to shelling out a lot of money to clear this headache. That's a separate headache you need to think about. The exam very happily says you have a maximum of 6 attempts for each part, but I think all of us would be, most of us would be seriously considering a third or a fourth attempt, because we would be quite aged and infirm. The examinations are held at very wide intervals, and you may or may not get an option to write it because there are long waiting lists. So unfortunately, you may not get an opportunity, although you are well prepared and you've even filled the form and paid the money. This is the website of the college, so all your questions will be answered, and even questions you didn't think you didn't think of would be answered on this website. A brief idea about the examination is that it's not testing so much the depth of your knowledge, but also the breadth of your knowledge, and it's comparing your answers or your score to the number of people who got a similar score. For example, in Indian examinations, we have a cutoff percentage. If you score 50%, you've passed the examination. 95% of the people appearing for the examination may score 50% and clear the examination. However, in these examinations, it's not that. You are compared to your peers who are appearing for that examination. So you need to clear the percentile. For example, in this situation, you can see the pass mark was a very odd figure of 62.21%, which means that it's not a preset cutoff. It varies depending on whether the exam is deemed to be difficult or whether the exam is deemed to be easy. If it's difficult, the pass mark is lowered, and if it's an easy exam, the pass mark is raised. Preparation for the exam is already been covered beautifully by Dr. Pranita. I would just recommend exactly the same. These are the textbooks. You can all access them. Most of them are the foreign textbooks are even available in PDF format, so you can go through those. And emergency medicine is specifically tested, so I would strongly recommend brushing up your already forgotten knowledge of cardiac arrhythmias and ECG reading, because these are important aspects of the examination, simply because you need to be able to assess the situation, establish a preliminary diagnosis, and initiate measures to stabilize the patient's condition in the form of a medical emergency. A few tips is that when you're preparing for this exam, be very practical, because you're not going to be asked what is the percentage of a particular complication, or what is this specific prevalence of a particular disease, but you need to know which diseases are more prevalent, and those should reflect in your answers, both in the theory and in the vivas. So generally, the schema follows from a life-threatening condition. When you're answering, you give out the life-threatening condition first, followed by something that's vision-threatening, and something of least importance would be a cosmetic indication. So the viva specifically, as I mentioned earlier, is 3 stations, which are 20 minutes each, and you're asked structured examinations. There's not much scope for the examiner to ask you anything at the top of his hat. He would have to follow a scripted format of the question and answer. If you hit those keywords, he would be happy and give you marks. If you unfortunately are not able to hit those keywords, he has a little bit of a leeway to give you some help, but you need to really be able to answer what is on his model answer sheet before you can be awarded those points. The clinical examination, as I mentioned, covers these 4 stations, and you get about 12 minutes at each station. On an average, you may be able to examine 3 or 4 patients. Generally, if you're doing well, the examiner would ask you to shift over to the next station. There are certain practical aspects, and you really need to prepare for the clinical examination, because it's totally unlike anything that we've done in our DNB practical or MS practical. Practice does pay. Keep practicing how you would answer in a viva, and this is where I would reiterate having a friend who's also giving the examination with you, and you can play off each other's answers and try to help each other give better answers. Some of the tangible benefits of clearing the FRCS Glasgow is you do not then need to give the PLAB to avail for GMC registration. If you don't have the FRCS, you would need to sit for the PLAB. There are changes, and there are yearly changes because of Brexit and other political decisions. So these may not be accepted as valid degrees in all different countries. So I would strongly suggest you know what are the licensing degrees before you embark on this journey. As I mentioned earlier, there are cross exemptions with different examinations which would be helpful for you. Many people just want to give examinations. They like the adrenaline high. So if that is really something that sails your boat, you would probably enjoy giving these examinations. And of course, you can add to the long tail of post-nominal initials, as some of our previous speakers have shown you. You probably don't need to go to this extent, but you could always be a little proud of a tail that is a little shorter than this, maybe. So there are some important disadvantages or caveats which I would like you to understand, that it's not, the FRCS Glasgow is not a licensing examination. You still have to go through the country's licensing examination and formalities. And of course, it's a fairly expensive examination, so plan in advance. So at Lakshmi Eye Hospital and Institute, we've been running this refresher course, which is directed mainly towards the practical aspects of the examination, the viva and the clinical aspects. Dr. Ashwin Gandhi is the brain behind it, and he's a regular faculty. And we also are privileged to have faculty members who are examiners for the examination. So you would really learn from a very practical point of view as to how you should appear for this. You could get in touch if you're interested. This course was discontinued over during the pandemic, but we are reinitiating it this year. So thank you, and anybody who's giving the examination, wish you all the very best.
So any questions or comments from the audience? Yes, Manu.
Yeah, it's not a question, just a couple of things that when I gave the exam a few years ago. If you don't have a good station, that you should not get disappointed that the entire exam has gone, because I think the clinical stations, I think, have more weightage compared to the OSCEs. So if you do well in your clinical stations, even if your OSCEs have not gone too well, which was the case with me, I think you can cover up there. So that is something you have to keep your morale high throughout the exam. Because I said it's a whirlwind exam. You just go from here to there, here to there. It's very easy to get disappointed. So keep your this thing there. And secondly, even if you've done DO, but if you've done your FRCS Glasgow, the Maharashtra Medical Council gives you an option of registering it as your additional qualification. So a lot of hospitals which do not take diploma candidates for a particular job, but if you have FRCS Glasgow or any such things, you will be able to get a job there because of the FRCS, and you can register that for additional qualification. And number 3, practice the mode of examination, how you speaking with your peers around you is extremely, extremely important. Crucial.
Yeah, so basically it's, as Devendra mentioned, it's not an exit exam. So there are topics which are no-goes, as you mentioned, Maya, but there are topics where if you have done poorly, but there are topics which are not considered as a basic topics, you'll be able to easily compensate in other parts. But if, let's say, if you couldn't pick up RAPD, which is a very critical part of managing a case, then there is a likelihood that even if you have done very well, you probably may not go through. So that they have those barriers, as you very rightly said. The second part about the Middle East, it's very dynamic, and now I think these initials, they really don't give a lot of weightage. They require you to have an experience in other countries, not just the degree.
Yeah, so please go ahead. We have one more question. While you get to the mic, just to say that the exam pattern, the philosophy behind it, the method of marking is totally different. So just as Maya pointed out, there's something called there's a pass, there's a strong pass, and there's a weak fail. So you can compensate. This is a little bit of behind the scenes information. You can compensate a weak fail with a strong pass, so they can sort of moderate your result. But if you've done something, made a single gross error, which may, in practice jeopardize the life of a patient, then that's a strong fail and you may not recover from that. Please go ahead.
What's the opportunity in UK?
Sorry, extra advantage?
In UK?
In UK.
What advantages FRCS gives in UK?
See, if you register for the if you have cleared your FRCS, that gives you an opportunity to register in the NHS website where you get a GMC registration. And if you're able to clear through the GMC registration, which also requires additional things like how many procedures, your log records of all your procedures that you have done, surgeries. And with that, if you're able to get through your GMC registration, you can go abroad and even practice there through the NHS structured, practice platform.
So basically, you don't have to write PLAB to register with GMC. It allows you to register with GMC with the added
Added
caveats.
things.
Yeah.
So remember that PLAB will test you from first year anatomy, physiology, biochemistry, general surgery, everything, your entire MBBS portion. So if you can skip writing an examination on that, I think you should be very happy if you can get away by just doing an ophthalmology examination.
Okay, with that, we'll move on to the next topic, and I'd like to invite Dr. Devesh Kumawat to be talking on the topic FRC of London, when to start and how to excel. Dr. Devesh has done his MBBS and MD from All India Institute of Medical Sciences, New Delhi. Subsequently, he has done a senior residency in retina and uvea from AIIMS, Delhi, and is currently working as an assistant professor in retina, uvea, and ROP unit. He's done his FICO, FAICO, FRCS Glasgow, and FRC of. I would like to invite him for his talk.
Thank you, Dr. Pranita. So I would be talking about when to start preparing for FRC of the examination and how to excel. And we'll see how this examination is different from the rest of the ICO and FRCS examinations. So as already been told that it's being conducted by the Royal College of Ophthalmologists, London. And it is a mandatory exit exam. Unlike other exams, it's a mandatory exit exam for the ophthalmology trainees in UK. So this has to be cleared by their 7th year of ophthalmic specialty training. And this exam could also be taken by the overseas candidate. And once they clear all the 4 examinations, then they are awarded the prestigious fellowship. Now, again, it's a structured examination pattern is there. The part 1 deals with the basics and clinical sciences. Then you have a refraction certificate, part 2 written examination, and a part 2 oral examination. So a recent change which has occurred is that now you can give a part 2 written examination before refraction examination as well. And unlike other examinations, there are no exemptions here. You cannot exempt any part, and you have to give all the 4 examinations to get the degree. Now, so when to start? So the best time would be the end of your residency. You should decide at that time whether you want to give this exam, and because that will be the time when you will have a mix of both the academic knowledge and clinical expertise. And how to excel in any exam, you should know the syllabus of that exam, and you should plan your exam. So that remains similar for FRC Opht as well, and a good clinical experience is very important. So now part 1 fellowship exam is an online proctored written examination with 180 questions that are split into 2 halves. And it is based on evaluation of your knowledge about the basics and clinical sciences, as well as patient investigation. So patient investigation is something which is different here. And so as patient investigations and clinical sciences which are relevant to ophthalmology are included, you cannot appear for this exam in your 1st or 2nd year of residency. So preferably you should appear in the 3rd year of third year of your residency, when you have a knowledge about the patient investigations. So the syllabus and resources could be, you can refer to them at the college website. Now, the second examination is the refraction certificate examination, which is a practical exam on clinical refractions, and it constitutes of 10 OSCE stations, which are very strictly timed. And these include performing a retinoscopy on simulator eyes or on patients, as well as subjective refraction, refinement of sphere as well as cylinder, and lens neutralization. Now, this part of the examination, that is the refraction certificate, most of the candidates who appear for this, the pass rates are considerably low as compared to other exam of FRC Opht, because this part we do not usually face in our final MS or MD examination or DNP examination that much that we face in the FRC Opht refraction certificate exam. So you are unlikely to pass this exam if you don't have enough experience. So the college also recommends that you should have at least 3 to 4 months of good experience in clinical refraction, then only you'll be able to pass this exam. Now, there are various resources that they are again referred at the website. You can go through them. But more important is that you have to practice, and only practice can help you pass this exam. Now, Part 2 Fellowship Written Exam, again, it's an online written examination with 180 MCQs. And this time, the whole of ophthalmology curriculum is covered, unlike the Part 1 examination. And you need to have minimum 4 years of ophthalmology training in UK or an equivalent degree for overseas candidate. So the best time would be again in the fellowship or while you're doing your senior residency in the 2nd or 3rd year. Now, syllabus, you can again refer to the college website. What is different over here is that you are also evaluated on health promotion, disease prevention, and professional and personal development. These are also included in the syllabus for this examination. Now, Part 2 oral examination constitutes structured Viva and OSCE like the FRCS Part 2 examination. And you should have cleared all the 3 previous examinations, because it's an exit examination. And again, during the fellowship and senior residency, the 2nd year or the 3rd year, you can appear for this examination. Now, the structured Viva is more or less similar to that of FRCS. But what is the main difference between FRC Opt and FRCS is that FRC Opt relies heavily on attitude, ethics, responsibilities, audit, evidence-based practice, and other things which are included in the general medicine practice by GMC. And the OSCE station earlier used to be only patient-based examination, but with the COVID pandemic, they converted it to completely video-based, and now they have switched to a hybrid mode where patients as well as clinical videos will be shown. A different part which is there in the FRC Opt is the communication skills section, in which you have one simulated patient who will be interacting with you, and you have to counsel that patient, and you will be marked based on your counseling and interaction abilities. So the patient interaction is very important in such examinations. Now, certain tips which are important for Part 2 oral as well as the written examination is that you should prepare the content list. What are the topics that need to be covered? Give adequate amount of time. Your Oxford Handbook of Ophthalmology or Kansky could be enough for your for referring to the clinical part. But for the non-clinical topics, you can refer to Oxford Manual of Training in Ophthalmology. And this examination relies heavily on the RC Opt guidelines and the good medical practice guidelines given by GMC, as well as ophthalmic investigation. So these 3 important aspects need to be fully read and comprehend. So that is different here from the FRCS and ICU exams. And these are certain books which I had read, and which other people who have cleared have also recommended these books, and you can have a look at these books. Now, most important is that you have to improve your patient interaction skills, because you are marked on the basis of how you are interacting with the patient in the oral examination. Now, pass criteria differs. So there is a preset pass mark which will be modified based on how other candidates in the exam have fared. So if everyone has fared equally good, then your pass marks may be very high. And if everyone has fared equally bad, then the pass marks may be low. So the pass marks, recent pass rates will vary depending on the place of examination as well. So if we see the May 2022 examination of refraction which was held in Delhi, the pass rate was as low as 40% as compared to 80% which was held in UK. So the difference in the refraction examination would be because I have already told that we do not pay that attention to refraction component in our MD MS examinations. Now, again, sir has already covered that these examinations remain valid for a certain period of time, and there are a number of attempts that could be taken before you are ineligible. So there is a long roadway because of multiple steps, prolonged intervals between the various exams, and there are limited diets, limited centers. So it could be easily it can take 2 to 3 years, even if you are clearing all exam in the first attempt. Now, there is the fees of these examination is exuberant, and every year, as Dr. Devender sir has told, that the fees keep on increasing by 5 to 10%. So in India, the oral examination which happened last year, the fees was 2 lakh rupees, and now it has increased further by 10,000. There is an annual subscription fees also which is there. So there is a membership fees that you pay, one time membership fees after clearing your exams, and then you have to annually renew your membership. So that is also one important thing that you need to look while you are planning for these exams. So the mantra for the exams remain mostly the same, that you have to know your syllabus, prepare well in time, give adequate time, practice, and there is never a wrong time to appear for these exams. The ideal will be when you are in your end stage of your post graduation or early part of your fellowship or SRship, but there is no wrong time to learn. You should always be ready to keep learning and educating yourself. Thank you.
Thank you, Dr. Devesh. Where are the centers for FRC of?
So the centers earlier used to be in UK only, but now we have in Singapore, and even in India we have started it last year in Shankar Nethralaya. I had appeared it in Shankar Nethralaya last year, and even in Delhi it has been started. So every once in a year it will be happening in India also. Majority of these examinations are happening.
And for FRCS Glasgow, where are the
CS
centers?
Glasgow also has multiple centers. They have in India as well.
Yeah.
The center in India is in Bangalore. So
Gangaram also.
yeah, so in Gangaram as well. So you have centers in India. It's not that you always have to travel abroad to appear for these exams.
But
So
the
I would-
downside is that the fees is very high for the exams which are conducted over in India.
The
So that
exam
is the
fees is high and the failure rate is high. Once you fail, you lose 2 lakh rupees and you have to appear again. And the next examination, you'll have to travel abroad because these exams, every 3 months, they are rotating the centers in countries. Travel, stay, another 1 lakh, you're spending 3 lakhs for one step. So you have to prepare really well.
Yes, Gangaram has for FRCS, but not for FRC of. They have not started FRC of examinations. Shankar Nethralaya and I think one more place.
Any other comments or questions for any speaker so far? ICO, FRCS or FRC of?
So one suggestion that I would like to make here, that unlike the ICU and other examinations, the FRC of the resource material is very limited, and maybe if someone is interested, that can be compiled based on the previous year's recall of the questions. We can make a question bank or maybe come out with a book, because that will be really helpful.
Especially for the practical exam, though, we have the clinical case scenarios.
Yeah, so somebody who was asking about the UK and this. So FRC OFT is an exit exam. So if you clear FRC OFT, you become, as Devesh mentioned, you become eligible to rise up in a UK system, registrarship and whatnot, once you fulfill other criteria. But this gives you a license to go up in a UK system. And also it is considered higher in other countries as well. FRCS, by and large, it keeps changing. I mean, Singapore a few years ago, FRCS Edinburgh was recognized, and they actually had a tie-up. FRCS MED were supposed to, they used to give it together. Then there was a time in between where instead of Edinburgh, they started recognizing Glasgow. And I think currently they don't recognize either. I mean, they have their own exam. I'm not very sure, though. As I said, it's dynamic. It keeps changing.
So now we've given all these examinations, and maybe life has taken a different course. So with that, I'll introduce our next speaker, Dr. Rashmin Gandhi. Sir has done his training at Shankar Nethralaya. Subsequently, he's a double FRCS from Glasgow and Edinburgh. He is a brilliant academician, a wonderful teacher, and from personal experience, he is an inspiration to me as well. And then after spending many years in an academic training institute like SN, he was involved in innovation, and he spearheaded the construction of a mobile eye surgical unit, or MESU as it's fondly called. It's basically a modified bus in which you can conduct cataract surgery. He works very closely with IIT Madras, where he's an adjunct faculty for the last 15 years. He is also an entrepreneur and has now interests in different continents. So he's donned many hats during his career, and I'm sure he will continue to do so. So with that brief introduction, I would like Dr. Ashwin Gandhi to speak to us on looking beyond ophthalmology and career options beyond ophthalmology.
Thank you, Dev. I think with my hairstyle, I have to don a lot of hats. Otherwise, the heat is little intolerable. Yeah. So this will be a brief, more like a discussion, because there are no like FRCS or ICO. There are algorithms and there are clear pathways, and you follow it and you achieve it. While life does not come with algorithm, it's like it's 360-degree open once you have given all these exams, and it's up to your interest and your way of life and your further aspiration, which leads you to wherever you need to go. So I would just probably just highlight as to what are the examples that I've seen or have experienced, which a lot of people succeed in. And this is not really, I don't know whether you have seen the program for this AIOC. They have certain cultural programs today, but also on Saturday there is a cultural program. It's called Life Beyond Ophthalmology. And obviously those, and there is a huge participation in whatever goes on. We had during COVID, we had few competitions which we conducted online, and the amount of talent that the ophthalmologists came up with was absolutely amazing. Especially we had conducted a singing competition, but there are people who are doing different kinds of competitions or platform. Of course, those are more for as an interest, but can you take anything apart from ophthalmology as your career option, or something which is allied to ophthalmology as a career option, and succeed or go higher? There are quite a few, not maybe I know of two people from India, but there are quite a few from abroad who either during residency or after residency take up an additional degree. And one of the popular degrees is MPH. There are people who go into public health, Master of Public Health, and there's tremendous amount of scope, opportunities and money in public health because of, and especially after this pandemic, there's a lot of interest in what really works at an individual level and also at the community level. And these are public health specialists are the people who deal with it. There are some amazing programs which are open to ophthalmologists, and I know of one of our colleagues who did MPH from Johns Hopkins, Bloomberg School of Public Health in Baltimore. And then you get invited to a lot of these global organizations like WHO. You're part of governmental bodies who would decide as to what the policies are going to be. The other stream that I've seen quite a few people take and succeed, not necessarily only ophthalmology, but doctors, is as a part of second degree is MBA. Now MBA has become quite sought after degrees because of corporate which are going around in India, which are practicing. A lot of ophthalmologists would like to practice in corporate sector, and MBA comes in handy. Same with entrepreneurship. People who want to do their own work, either ophthalmology or some other business. We generally don't know about finance. We don't know about policy making, and MBA gives you that added opportunity. We have a physician who did his MBA and then went for one of the boot camps, as they call it, at MIT Boston, and he did so well that now he has become a faculty for, though he's a physician, faculty for entrepreneurship at MIT Boston. So with all these different excitement and interest, especially in India, in entrepreneurship and business, some of these work very well. The third area which a lot of early mid-career doctors go in is technology. There are a lot of technological institutions who look for doctors as partners, research scholars, and even faculty, because healthcare technology innovation is something which is at the forefront in most technological development. Apart from environmental impact, healthcare is something which is really exciting for a lot of institutions, and you get a sizable recognition and a good amount of money if you join as a consultant in these, and you really don't require a lot of training there because you're going there as a consultant to feed them about the healthcare and what is required and what are the gaps in healthcare or how do they work on technology. And then there are a lot of opportunities. It's not really beyond ophthalmology, but opportunities outside India, not necessarily only in UK, US, or Middle East. There are a lot of organizations who work in the Middle East or in Africa where there is a lot of excitement and there is a lot of work which is going on. So that's something which is a good option for an early career doctors who can go get exposed to a new culture, do a very high amount of surgeries, and also earn a good amount of money. So these are, I think, some of these. Obviously, this is not an exhaustive list, but something which were my thoughts.
Of course, I mean, it cannot be a prescriptive kind of talk. But sir, if you have somebody in front of you today, a fresh graduate, postgraduate, who probably is a first generation ophthalmologist or first generation even doctor in their family, disillusioned with the idea of doing clinical medicine or clinical ophthalmology, what would be your advice in a very general way that you could give so as to so that this person can sort of broaden their ideas as to what to do in life?
So all three that I mentioned, if somebody is disillusioned completely with healthcare, then obviously a technological institution is a good, because as I said, there are a lot of opportunities to collaborate with them. If somebody is just illusioned not with healthcare but only the clinical science because of imperfections or what goes on in the society, then this administrative jobs, and there are ophthalmologists who become administrators and have done well. So MBA would be a good option for them.
Does anybody in the audience have experiences or ideas that they have themselves pursued or would wish to pursue? And if they're comfortable sharing them with us, we would love to hear those.
Anybody having a startup working with ophthalmology or not? Yes.
Please go ahead, sir.
So I've done an MBA. Well, it's a certificate in corporate innovation from Stanford, and that sort of gave me an overview how to look at new ideas for research, new ideas for startup companies, whether it's healthcare or any other sector. The key thing it teaches you is how to look at the financial aspect first, and then the idea dies before if it doesn't make financial sense. That has also allowed me to sort of laterally work as vice chair for the product evaluation committee of my hospital where I work at Cleveland Clinic Abu Dhabi. So I don't look after just ophthalmology product evaluation. I look at product evaluation across the entire hospital. And that means, cardiology, cardiothoracic, you name it. I've also done a course from Berkeley on machine learning and applications in healthcare. So as we move forward towards developing artificial intelligence and other applications within the hospital, I'll be part of the think tank that, so there's lots of avenues to do things outside your comfort zone if you're willing to do that, because as you get old and as our hands start to not be as good as they are right now, we need to have avenues and interests to keep us excited and move forward, and also allows us to sort of keep ourselves employed.
Oh, brilliant. Thank you. Thank you for sharing this. Very good.
Fantastic. So I think that sums up the flavor of this session very well, that we have a lot of options after qualifying, and it's one may think that getting the degree MS or DNB is the end of the story, but it's actually just the beginning. So on that note, I thank all of you for being present here, and it is my great privilege and honor now to introduce our keynote speaker. Please come, sir. Dr. Sharfuddin Ahmed, sir, we are very privileged, sir, that you are able to join us today. Sir is the incumbent Vice Chancellor of Bangabandhu Sheikh Mujib Medical University in Dhaka in Bangladesh. Sir has served as Pro-Vice Chancellor of Administration at BSMMU, and he is the Secretary General of the Bangladesh Medical Association, the BMA. He is, of course, an ophthalmologist, and he's going to be speaking on international fellowship examinations and career options after post-graduation. Sir, you're most welcome, and Please, you may.
Good evening to you all. This is the post-lunch meeting, and I think everyone is sleepy. Before my starting of this talk, I had one joke. One is that if any person cannot read, but the ophthalmologists say, read this line, and if he cannot, you can say that you are totally blind or you have cataract. But when the person will say, I am illiterate, I cannot read, then what will be our situation? In this gathering, I want to say that anatomy and physiology, it is very not liking of any students. And also this medical education, even postgraduate medical education, is not so much touchy to anyone. The respected panelists and the ophthalmologist and the future ophthalmologist who wants to get the post-graduation, ladies and gentlemen, one thing I want to start with, that successful people never stop learning. We should think of this one. Today, I want to share with you some of the considerations of post-graduation, why, when, and how, and what are the financial support and what is the situation of your family. How will you go forward? Not only UK and USA, there are a lot of countries we can go. In Australia, in Japan, in Africa, already you have heard from it. And in my country, we have 5 years MS. But in your country, MD in AIMS, 3 years, and MS also 3 years in some of the institute, and DNB 3 years in some of the institute. There are a lot of degrees in my country. Once upon a time, you all know about the DOMS, Diploma in Ophthalmic Medicine and Surgery from Austria. They came and they were the first ophthalmologists in the world. I will remember that there was some of the DODLO. At the same time, 2 degrees were there in the same person. They were the ENT specialist and also eye specialist. In my country, there is the only, I have started that one, the community ophthalmology MS degree. It is not in India. But I think there are diploma in ophthalmology, there is diploma in community ophthalmology in my country, and the 5 years MS course, I have heard that all the prerequisites, part 1, part 2, OSCE, OSPI, MCQ, VIVA, and clinical examination like FRCS. In my country, it is the CANMED. In my university, we are giving this 5 years course. I think, I am thinking today that why it is not clinical PhD? As because basic PhD is everyone interested. But if I make this 5 years course, we can make it clinical PhD in ophthalmology. In future, that will be more interested by some of the young ophthalmologists. We can make a set that there is the paraclinical, basic, fellowship, master degree, diploma in every areas, and UK there is GP and specialist. In my country, I have already told about that basic, paraclinical, clinical. There are some fellowship also. After passing MS, we have 1 year fellowship for either in ophthalmology, retina, glaucoma, cornea. They have the study pattern. And the people who are in residency, they have the entrance examination after 1 year MBBS and then 1 year clinical. Then there will be the phase A for 2 years rotation, and after completion of phase A exam, the 3 years rotation in particular subject, and there will be the phase B examination. Along with this, there is the thesis in this MS examination. And there are also one college, FCPS, and the BCPS is the college. There is also giving another FCPS with entry, lateral direct examination, and 3 years rotation in particular subject. There are MPhil and diploma in other subjects, and also there are the opportunities you have already heard about in United Kingdom, USA, Canada, Australia, and also Japan and China. And Africa also, there are some areas for post-graduation. But the salary, average yearly salary for an specialist, there is highest in Canada, and also in Australia, they are getting much more. But we don't want to leave the country. We want to get our degree, and we want to serve the people of this country for the prevention of blindness. There are some Australian Medical Council, they are giving some of the post-graduation. There is needed of IELTS, and without examination PLAB, you cannot attend in any post-graduation. And there are the MRCS, MRCP, MRCOG, FRCS, FRCOP in UK. There is also MRCP entry examination. They can come, and after 4 years, they have the another. After MRCS, they can also training and get the post-graduation. There is needed of PLAB. Now, after getting the post-graduation, you see, in our country, what was our past situation? I told about the DOMS. In the Indian subcontinent, you all know, we are the pioneer in cataract surgery in the whole world. Sushrota, who was born in Bikrampur, now it is in Bangladesh. At that time, it was Indian subcontinent. We started by couching. And it was the past cataract surgery, couching, and also by giving Kabliwala from Afghanistan. They were selling their spectacle, each and every house, and which one is corrected, that can be used. Nowadays, you see, this couching have turned into phaco surgery, and within 10 to 20 minutes, we are earning a lot. And in future, I am thinking that artificial intelligence will come up and robot will take over. But we are the man behind the machine. With the machine learning and deep learning, we should be trained much more. As because today, some patients come and say that in Google, I got that this drug should not be given as because there is a lot of side effects. So we should be alert enough that even in surgery, there should not be any mistake. Otherwise, they can sue against us. So previously, you see, in machine learning, in ophthalmology, CT scan, OCT, and FFA, all these are the machine learning. Nowadays, I think in future, a robot will come up, and for the treatment of keratoconus or the cataract surgery, also there should be some of the lasers which will be given by the robot. That is the future of the post-graduation in ophthalmology. So we should be alert enough, and I hope in this way, ophthalmology should come up. The ophthalmologists who are not yet still only after MBBS, they should come up as because prevention is going such increasing much more as because in our country we have 16 crore people, there is 160 million. We have 1,300 ophthalmologists. In your country, I think 15,000 ophthalmologists are in India, but it is not sufficient as because the increasing diabetic retinopathy and increasing life expectancy will cause much more ophthalmic problems and blindness. And everyone should come up to treat it, and ophthalmologists should be much more than nowadays. If anyone is not interested, they should come up. I'm thinking that in my country, the ophthalmology subject is not much interested by anyone. Why, I don't know. Even it may be in India. So I proposed that in future, if necessary, there should be given incentive. Otherwise, the prevention of blindness will be hampered in all the countries. That should come up. We have already learned about the training. We have learned about the degrees. FICO, it is also going on in my country. FACS, FRCS, American College of Surgery, surgeons and FRCS all are getting their degrees. But the main thing we should remember, degree will not give me anything. Learning is a must. Where we are getting the training, that should be 100%. Otherwise, this degree will not give me bread and butter. I think my talk is like that. Everyone should be sincere in their learning, in their training and teaching. Along with this, the thesis should be a research-oriented, as we can prevent the diseases, ocular diseases. That will be helpful, and that will be the movement for prevention of blindness. I am very much grateful to AIOC, as because you have invited me, especially President Lalit Verma, and also Namrata Sharma, Secretary General, and also Partho Vishwas. I am grateful to them, including all the organizers who have invited me. With these few words, thank you very much for patient hearing.
Thank you so much, sir. Thank you. I think you shared a wonderful perspective, both from a public health standpoint as well as from an individual student standpoint, and I think it was very valuable. If there are any questions on any of the talks that anybody has, we would love to take those questions, or if anybody has any comments and statements, we can share. They can share them as well. With that, I hand over to Dr. Pranita for closing remarks, and we can then conclude the session.
So I think we have had a wonderful session and a nice interaction that we have had with the audience. And I hope we have given some information and insight about these exams and brought in some clarity in your minds about these exams. So with that, we'll close this session for today. And we are always open to your questions over dinner and lunches in the subsequent days. Thank you. And thank you, Dr. Devendra, for this wonderful program that you designed.